everyone. Thank you all for joining us for our Hello Health session for this month. My name is Caroline Price. I am the Administrative Officer too with the Connected Care Program, and I will let our speaker introduce herself for today.
Hi, my name is Alba Natali. I work as a clinical disease nurse, the public health nursing supervisor for Cumberland County Health Department. I work with epidemiology in the STI clinic to make sure that we stop the spread of disease.
And so, as she mentioned, today's topic is around STDs and STIs. So, we will go ahead and let her fill us in on some of the facts and figures of STDs.
I just want to say I'm so happy to be here because this is like one of my favorite topics. I think this is something that we know about, we talk about, but we don't really talk about. So it's really important that we talk to our community and make sure that everybody knows what we're dealing with when we're talking about STIs. A lot of times it's something that for some people it's taboo. We don't talk about sex. We don't talk about STDs. But for some people it's really important, safe sex, condom use, getting tested. So I think it's really, really fun to talk about STIs in a way where we are educated, but we also know that there are some issues that we need to make sure that we're aware of. Case in point, the syphilis rates in Cumberland County and all over the United States are continuously rising. So syphilis is an STI. It's a sexually transmitted infection, easily preventable. But here we are where we're having a lot of babies dying because of congenital syphilis. That's when the mama has syphilis. And so all these things are super preventable, but we're still dealing with them. And so here in Cumberland County, our job is to make sure that we make people aware of STIs, that we keep them safe. We'll give you condoms all day long and just do what you do, but just do it safely. But we also want to make sure that people are aware that the STI rates they're always on the rise. I think we did down a little bit before or during COVID. People stay separated and read a book or had hobbies. I don't know, something, right? But after COVID, we started seeing a spike in rates again. We're talking about chlamydia, gonorrhea, syphilis. We're talking about HIV and AIDS. And so we want to make sure we stay informed, we stay safe, we have a healthy sexual lifestyle, and we do what we do out there, but we stay safe. So that's what we really want to talk about today.
Perfect. So, what would you say are the top 5 STDs that you all have found are most prevalent in our community?
So first and foremost is chlamydia. Chlamydia is one of those that will continue to rise. The problem with chlamydia is about 70% of people, especially women, have no signs or symptoms. So unless you're getting tested often, you don't know that you have it. So we're continuously spreading it. So signs and symptoms could be anything like discharge, could be odor, something hurts down there, something don't feel right. But a lot of times when we don't have a symptom and we're not seeing our GYN or we're not seeing our healthcare provider, we're not getting tested. So we're just spreading the disease. So chlamydia is a big one. Gonorrhea is another one. That one is mostly seen in men just because they do have symptoms. And men are kind of like, oh, I shouldn't be burning and having discharge. They come and get tested often for that. So gonorrhea is on the rise as well. Syphilis, again, that's the one I worry about the most. Syphilis is a little trickier. Syphilis is what we call the great imitator, right? So it's an STI, so you can get it's a sexually transmitted disease, but there's a couple different stages. So unless you're paying attention to your body, you wouldn't even know that you have it. And so that's how it's spreading, and it's spreading like wildfire, especially in pregnant women. So we want to make sure that pregnant women are not only are they having prenatal care, but they're getting tested 3 times during that pregnancy. HIV and AIDS are another one. So we have to separate them because HIV is the virus that causes AIDS. So we see a lot of cases of HIV, but unfortunately we're also seeing rises in AIDS, which means that someone went undiagnosed, untreated for years, and now they have AIDS. And so those are the ones that we really, really want to hone in on education. But those are the ones that we're seeing the most rise in the cases.
So, as far as the STDs that you just mentioned, are all of those treatable or are some more treatable than others? Tell us a bit more about that.
Yeah. So chlamydia and gonorrhea and syphilis are all treatable and curable. So once you get treated, you're good to go. Unfortunately, people end up having them again because they're doing the same sexual behavior. So that's what we want to prevent, right? So I can treat you for chlamydia, I can treat you for gonorrhea, I can treat you for syphilis, but if you don't change your behavior, you get it again. I think previously on another episode, we talked about antibiotic resistance. That's happening a lot with gonorrhea. So we want to make sure that we're talking to people like, please be safe, wear condoms. HIV and AIDS is treatable, but unfortunately, there's no cure as of yet. Hopefully, one day. So we want to make sure what people when they're getting tested and if they test positive, that we're there for them as to connect them to care. So there are medications that they can take, especially now with the Medicaid expansion. There are ways that we can get people that medication, and they're living a lot longer than they used to. Let's say like in the 80s and 90s. So that's a lot of what we do.
So, when you're looking at the STD rates in Cumberland County, give us kind of an understanding or a best estimate of kind of what those rates look like in our county.
So Cumberland County is, we have Fayetteville, Hope Mills, Spring Lake, a little bit of Spring Lake, and so we are not considered a large county, but with STIs, we are usually in the top five. For 2023, we were like number four for chlamydia, gonorrhea, HIV, and AIDS. And so when you think about it that way, you're like, wow, there's not that many people here. When you compare us to like Wake County or Mecklenburg that have over 1 million people, to be in the top five is kind of scary. That means that we're having sex, but we're not being safe about it. And so we want to make sure that people know that when you're meeting folks on Tinder, when you're going to the clubs, that you got to know your partner and you got to know your status, right? So our health department offers, I think we're the only free STI clinic in Cumberland County. So we offer testing. We want you want to come every 3 months, by all means. We want you to make sure that you know where you're at, that you are HIV negative, that you don't have anything going on, and that if you do, you get treated. But yeah, for a county that's a little small, in my opinion, and we're talking about 100 counties in North Carolina, we are usually top five. And then when you talk about North Carolina as a whole in the United States, we're up there with STIs. And so that, begs a lot of questions. Like, what can we do to make sure that people know that you can have sex and you can have sex with multiple people if that's your thing, but just be safe about it? What can we do to prevent STDs? What can we do to make sure that we get treated? So it's a lot of conversation that we should continuously have.
So, and you mentioned COVID a few minutes ago. In terms of the rates of STDs prior to COVID and as well as after COVID, did you all see a majorly significant change in that? Or was it kind of, like you said, things kind of died off a little bit? But have you seen things pick up as the course of time has gone on?
Yeah, so before COVID, we were here in STIs. Then COVID hit, and like I said, everybody was reading a book or something. They were home, and so they weren't. And a lot of times, they weren't even getting tested. So people were not that they weren't having sex, they just weren't coming to get tested. I mean, you have to think about all the places that closed down and things like that. So during COVID, there was a dip in STIs, but it's been slowly creeping back up again. People feel more comfortable now, and so we're back to the almost pre-COVID numbers where the chlamydia and gonorrhea are still really high. And then we're talking about there's been a shift though in like the age range. So usually STIs are really like big in like late teens to early 20s. But we're seeing an increase in older people, like my grandma's got an STD, and you're just like, no, we got to be safe. So we're seeing an increase in older generations. We're also seeing an increase in African American women and men, especially in syphilis. And so I know during COVID, everything kind of, shut down a little bit, but we still need to make sure that we take the right precautions and the safety and the condoms and just the education, because all preventable.
So, and you mentioned a second ago that African Americans were highest in that category. Are there certain STDs in terms of in relation to certain populations that are more um, acceptable to getting that? What are kind of some of the correlations with that?
Yeah, so for chlamydia, mostly women get chlamydia. For African American males and females, they are having high rates of syphilis. And that is, so a lot of times we talk about syphilis or STDs in general as um, men who sleep with men. They have the highest rates. That is correct. But unfortunately, we're seeing a trend where African Americans are having higher rates. And so that it's so awesome that we're here talking about it because that's another educational point, right? Like, so what can we do in our communities, especially in Cumberland County? We have a high African American population. What can we do to reach them, to educate, to make sure that they know that, hey, this is on the rise. We got to do what we got to do to make sure that we don't get things that we can't cure. I think before you asked me about some STDs, herpes, for example, it's treatable, but you can't cure it. So once you have it, you always have it. HIV and AIDS, once you have it, you always have it. So we want to make sure we continue those conversations. Gonorrhea is usually seen mostly in men. And then don't want to not talk about it, but a couple of years ago was Mpox. Mpox was a big thing, and that was something that you would have never thought was going to be the United States. And sure enough, it came over here, and it's not even an STI, but the way it was spreading was sexually. And so we always have to be on the lookout. We have to make sure that we know what we're dealing with. And when people, we can't deny people. We're humans. We love to have sex. We love to be connected. We like to have that intimacy. But there are things that come with that that we want to make sure we're educated and we stay safe.
So, and you mentioned, outside of the top 5, STIs that we see in our community, you mentioned a couple more. Are there any others that you have seen any an increase in our community over the last 3 or 4 years?
Yeah, that's a good question. So, the ones that I've mentioned before are reportable. That means that all healthcare providers have to report that to us, to the communicable disease branch. There are some that are on the rise that are not reportable, which are kind of harder to track, but we're seeing increases. An example is trichomoniasis. A lot of people don't have, they have no idea what that is. Yeah, so it's a little parasite that's alive. All right. And so when you look at it under the microscope, it's swimming in there, right? And so you need about 100,000 of those to colonize so you can have the STI. It's not reportable though, right? So we're seeing it, we're treating it, and we're trying to help partners not get it. But I can't give you a definitive answer of how many, but I know that we're seeing a rise in that. One of the things that's hard with trichomoniasis is that men are often not tested for trick. We test them at our health department, so yay for us. So we want to make sure that even though it's not reportable, herpes is not reportable either, that we're still treating it, we're still educating, and that we're still trying to prevent as much as possible.
So, what would you say to someone who, were to walk into that apartment tomorrow and, and say, I need to speak with you about something that's, concerning to me? How would you approach someone who walked in and kind of expressed to you that they were having some of the signs and symptoms? How would you all handle that from start to finish?
Yeah, so that's a really good question. We have that all the time. We try in our STI clinic, we try to do an appointment-based system, just because it's a little easier to manage. However, we do have people walk in all the time. We try to make appointments and we try to fit people in as best as we can. But when someone comes in and they have questions, and sometimes it's good questions. It's good. So we'll usually they call me or my clinic coordinator and we talk to the person about what's going on. We do a little triage. I want to make sure that you're in the right place. Sometimes unfortunately, symptom is not STI related. So we want to make sure that we have a nurse talking to that person. And if we got to see them, we'll see them, especially when we're dealing with any symptoms related to syphilis. So if someone says, I have a rash, I want to see that rash. And so you will be seen today. So one of the things that we have at the health department is if you have symptoms, we see within 24 hours. So if I'm struggling and I have no appointments, I'm going to find a way for you to come in and get seen. And especially because we're free. I don't want people paying for testing. Testing can cost upwards of hundreds of dollars, and that's not including treatments. If you need a penicillin shot, that can cost you quite a bit. And so come in. I'll say that all day. Come into the health department. Come see us. We will test you. We will treat you. We will educate you. I'll give you my card. You can call me, email me. We're there.
That's a great lead into my next question, actually. So, what are some of the resources in our community that are available to those who might, have a recent diagnosis and might not be sure where to go or what to do for help? So, what are some of the things in our community that are present and available now, even at our health department or outside of that, that can assist us most?
So unfortunately, no one else is free, so that's a problem. However, STDs don't work on a Monday to Friday schedule, right? So we do have people that often go to the ER, which I advise against, but if that's what you gotta do, they go to the ER for STI testing. There's urgent cares. Like Next Care is open 7 days a week, so people go there. And if you have insurance, insurance will cover it. Insurance covers all STI testing. There are places like your healthcare provider, your PCP, but usually those are the biggest agencies that do STI testing. Um, we have infectious disease clinics that are run by healthcare providers that treat HIV and AIDS. They also do PrEP, which is a pre-exposure prophylaxis for HIV. And so we often see their patients when they don't have the penicillin to treat them.
Okay. So, are there any online resources or anything in terms of if folks might not be comfortable necessarily going to someone in person? Are there online resources for those folks that might be a bit more hesitant to reach out in that first aspect?
So the beauty of today's world, 2025, there is a billion and one places to go, right? And you also have at-home testing for STDs. I don't think those are free. Don't quote me, but I don't think they're free. And I'm not sure if insurance covers those, but it is available at-home testing. However, you get, I think, if I'm not mistaken, so you do at-home testing, then a nurse calls you and you just get the education and get the medication prescribed. Again, I'm for free, 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 free. So if somebody does that and they want to come to our clinic and get their medication for free, I will find a way to get it for you. Loopholes, right? Because we want to make sure we test people. Not only that, we do that one-on-one education where we build a rapport with our community members, and they'll ask us a million and one questions, and we want to make sure I'm looking at you and saying, "It's cool that you have 5 partners, but let's wear some condoms, right?" And we talk about things like oral sex. People never talk about oral sex, and we say you should wear a condom. No judgment, no nothing. We talk to people like, like you're my friend. I want to make sure that you understand what you're doing and what you're going through, so you don't keep coming back here. Now we're here for you, but be safe about it.
So I know that there is a World STI Day. Tell us a bit more about that, when that is, and are there any things in the community that we do to address that?
So STI Awareness Month, it's actually a whole month. It's in April. So there's a week specifically designed for STI awareness. But April is the whole month of STI awareness. The CDC does have, if you go on the CDC website, they have numerous things that you can look at. They have like campaigns, resources, education. They have even education that's geared towards like healthcare providers versus, just a regular citizen. So like that, you understand what you're reading. So this month is dedicated to STIs all over the world, all over the United States. Talk about it, treat it, and or test it and treat it. There's different campaigns, but really it's to raise awareness, to decrease the stigma. Again, people sometimes they don't talk about STDs because I shouldn't talk about it. It's taboo. I don't want people to want to have sex. We have sex. Let's be real, and let's make sure that we're safe about it. So the CDC is a wonderful website resource to go to.
Perfect. And so, and you mentioned too, of course, again, resources that are out there. Are there any new up and coming, I guess, trends that you're seeing in terms of any STD in general? Are there any trends that you're seeing when it comes to certain STDs over others? Talk a bit more about trends that you're seeing, again, in our community, but of course across our world as well.
Congenital syphilis, and so that one is one of the scary ones, because we're talking about pregnant women who are giving birth to babies who. So when you have syphilis as a pregnant woman, you could potentially spread it to your baby. The baby, you can have a miscarriage, you can have developmental issues in the baby, you can have a stillborn, and so 100% preventable. So that is an alarming trend. That's something that we're seeing over the last couple years. A few years ago, we had 0 deaths of congenital syphilis, and I think, I can't give you an exact number, but I think we've doubled that in the last couple years. Completely 100% preventable. So we want to make sure our pregnant women are seeing their doctors and are getting tested as they should.
And so, again, talk a bit more about local programs that are in our community that can assist those that have been recently diagnosed or that are still going through the process.
So the Cumberland County Health Department does have a maternity clinic. That's for low risk pregnancies. So they do a phenomenal job of trying to get people in whenever they first find out that they're pregnant. And there is a North Carolina law that says you do have to be tested 3 times. So we try to get people in to get those testing at the right proper time. We want to treat people, the pregnant women, as soon as possible. We want to provide, there are things that we can do like rapid testing in clinics, especially for women of childbearing age, so we can find the syphilis before you get pregnant and treat it. We have a lot of community members that do a lot of testing and treatment, like your GYNs. We got Cape Fear Valley, who does a phenomenal job with pregnant women. For the most part, I think right now we're suffering a little bit of I don't know what they call a OBGYN desert. We don't have many providers, so we do as much as we can as the health department to make sure that if people need somewhere to go, that they can at least come to us and find the resources. I don't claim to be an expert on maternity, but we know where to point you in the right direction. Yeah.
I was going to say, and I think, kind of piggybacking off of that, I think it's important that we understand that, we might not always have an answer, might not always have the exact response that's needed in that moment. But I think it's important that we understand that, we need to keep in mind that there are resources in our community that are available that might not be the best fit, for them in that moment. But, there are folks that are in the community as well. And mentioning the OBGYN dentist, I think that's a super important, thing to mention because I think folks just automatically assume that there's going to be someone to go to when it comes to that, and there's not always, immediate person to go to or immediate group to go to. So I think having the health department there seems to be a really beneficial resource for those in our.
And you think about like the people who don't speak English. We have pregnant women who are Haitian, Spanish, Arabic, or they don't. And so to help them, navigate that, the healthcare is it can be really scary for them. And so having a place where you can feel trusted and not judged and you feel assisted, like somebody really wants to help me, I think that's an amazing thing that we do. And plug in the health department because we're awesome.
Yeah, agreed, agreed. I think that, we're a common resource, but I think we're also a resource that we kind of provide a little bit of everything. So we kind of touch on certain things, and I think it might be a more comfortable space for folks. Again, and it's a bit more of a one-on-one intimate kind of setting versus there might be certain things that are kind of expressed or discussed in different ways in other places. So I think having an apartment there is really it sounds like a good resource to have. For all ends of the spectrum. So. Um, I didn't have any other questions for you unless you, needed to share anything else about STDs or STIs.
So for the most part, with STIs, STDs, sexually transmitted infections, we want to make sure that all our community members know that we at the health department are all about safe sex. If you need, we give condoms for free. We have different condoms. We have non-latex. I don't have lambskin though because that's too expensive. But we have rib for her pleasure. We have them all. So if you want to come to the health department, you just ask for the supervisor for Alba. I'll give you some condoms. We have a health education department that also provides I think if you go to our website, there's a way to request things. There's even ways to request education. Like if your organization wants people to talk about certain things, that's what we can do too. But just know that the health department, the STI clinic is always open for education, for anything that you may need. Heck, we even carry flavored lube. Like, you do you, just do it safe. Right.
Wow. Well, there you
So
go.
yeah.
A little bit of everything.
Mhm.
So, well, thank you, Alba, for being with
Yes,
us
you're
today. We
welcome.
greatly appreciate it. And thank you all for watching with us as well.